April is Autism Awareness Month. To help us gain a greater understanding of autism, we were joined recently by Dr. Bruce Waslick from Baystate Medical Center and Marty Belarjan of Southwick, who cares for her autistic grandson.
Autism is what we call a developmental disorder. It strikes kids early on in life, and some evidence suggests that kids are born with it. And it affects their development throughout the course of their life. So early on, we see different types of developmental delays, like language delays, but the key symptoms are difficulty interacting socially and understanding social behavior, and also tending to get caught up with certain very fixed ideas and interests that go beyond and outside the range of normal.
Doctor, let me ask you as well, the numbers in terms of autism in cases identified have changed dramatically in recent years. In just the last decade or so, the government Center for Disease Control took it from 1 in 68 births, now from 1 in 125 in 2004. That's roughly doubled in about a decade, twice as many. Any idea why, or are we just being more observant? Do we know more? What's your sense?
I think it's a combination of things. Actually, when I was in training 20 years ago, we thought it was much more rare than that. But recently, there's evidence suggesting that kids with these type of developmental delays are fairly common. You know, it probably is a matter of more people being aware of it, getting kids identified, sent to specialists for diagnosis, identifying kids' needs at the level of the school, the primary care doctor, people understanding more about autism. I think probably what the answer to that is that we were very much under-recognizing it 20 years ago, and now we're more aware of the scope of the disorder and how it affects so many kids.
Marty Belarjan, as we said, you care for your 11-year-old grandson. It's a full-time job and then some. And I know you've said Autism Awareness Month is important because we all need to be more aware, more sensitive, more accepting.
Well, and the reason I say that is these kids look normal. It's made me accept people a lot better. I can remember being in a restaurant, seeing a child misbehave and say, you know, what's wrong with the parents? Why don't they just reprimand him? You know, and you know, he needs to be dealt with. But it's their brain. You just don't know what's going to trigger them and what's going to happen and how quickly the situation can change. It could be anything. It could be a sound, a light. You know, we don't go to a lot of concerts and different things because the noise is too much for them and can set them off. When you're talking with the brain, it's very complicated.
And not to get too personal, but have you had some of those experiences yourself where difficult times and maybe people aren't as helpful or accepting or aware as they could be?
They look, you know, people look at you and they wonder, but in 2009 is when I started at Baystate Behavioral Health. And we were on vacation, and extreme meltdown. He became violent. I got a hold of Baystate, and at that point they made their outpatient hospital available to us, and that's how we finally were able to get him diagnosed. You know, I just couldn't control him, and didn't know what and why, the reason he was just acting this way. You know, what I knew about autism is they don't look at you and they're not loving. But he's very loving. And so as the one bringing him up, I didn't know that there was something wrong. I knew he had delays. We had been to his neurologist. He did have brain damage, but he hadn't been diagnosed at that point. And he has multiple problems. He has ADHD as well, which a lot of these kids do. It's not just one.
Dr. Waslick, let me ask you, there are a lot of thoughts out there. It's thought to be genetic, perhaps. It's thought to be perhaps some environmental factors. What do we know about why this happens to young people?
I don't think we know as much as we need to know. I mean, there's a lot of risk factors. So we know that autism runs in families, but not every kid born into a family with autism is going to develop autism. It's still fairly unclear. There are probably some environmental risk factors that we don't even fully appreciate at this point in time. I think it's clear that there's a very profound neurobiological change in the brains of kids and adults with autism. Characterizing those changes has been more of a challenge. I think we're making progress, but this is a brain-based disease, and I think we need to recognize it as such.
I interviewed a gentleman a few years back who was identified with Asperger's syndrome, an adult and very high-performing, and he was very self-aware, and he told me, he said, I'm going to seem very blunt and maybe insulting at times, but it's just that I'm direct. If you ask me something, I tell you. That's just how it is. And he also said, just think of me as someone whose brain works and thinks a little differently.
Right. So he's got very good insight. So he has an understanding, and he's come to terms with his difficulties, and you can get that from an adult perspective. And some kids will also have that perspective. But kids growing up, they don't necessarily are aware of what's going on and what's wrong with them, what kind of troubles that they're having. And that's a learning process. So being able to recognize that the kids have autism, what their strengths are, what their deficits are, what their weaknesses are, what are the things that they need to improve upon to function in the world, that's a lifelong challenge for kids with autism spectrum disorder.
Marty Blarjan, you've said caregivers need to be totally proactive for their autism child. They've got to be ready to fight.
You have to, because there's a lot out there, but there's not one central place you can go and get connect all the dots. So at school, you've got to make sure you have a great IP for them. You've got to make sure you've got the right one-on-ones and therapists working with them. Then the therapists, like we go with Baystate Behavioral Health, outside help, right side, summer camp. It's a nightmare because kids are wild as it is, and now you put them into the mix and trying to make sure you have the right summer camp for them. So that's probably the hardest challenge, is there's not one area you can go to and find all these things. He goes to therapeutic horseback riding because it's really good for the kids. So, but you've got to find everything separate.
You've got to work at it and take some time to find what works for you, for your kid.
It's a full-time job, and if you're working, it's hard to do that.
Exactly. Dr. Waslick, I know there's no real medical or treatment as such. There are some medications that seem to help sometimes, but what's your sense? There's a lot of research out there, a lot of interest, I think, in the topic. What's your sense of 10, 15, 20 years down the road where we may be with autism?
I think the key is going to be early identification and early recognition of the disorder. I think the evidence is mounting that the sooner that we can recognize that kids are suffering from these kind of problems, the sooner we can get effective interventions to them. So increasing the awareness of the community, providers, school people about getting kids identified at an early age and getting services at an early age, I think is going to lead to better outcomes. I think we're moving along those lines in terms of the research. And it's not necessarily a medicine or things like that. It's getting them the services they need to support their development. That's the key.
And we don't want to scare anybody, but take a minute, tell parents who may be watching, what sort of things can they watch for in a child? And I think parents have such a sense of their really little ones, if something's not right, but what do you watch for that says, let's get some evaluation?
I think really around the first year of life, some of the symptoms can occur, and those would be clear onset of developmental delays. And some of the delays may be subtle, such as social interaction, but others are more profound, such as severe language delays, severe physical motor delays. That can give you an indication that the kids are not developing as they should. The social delay, the social interaction, and the profound sensitivity to minor changes in the environment can really throw kids off. So if parents have any kind of concerns about the developmental progression of their kids, even as early as 12 months to 24 months, bring it to the attention of your primary care provider. The primary care provider hopefully will be sensitive, be aware, and help point people in the right direction to get an assessment.
Well, Dr. Bruce Waslick, Marty Blarjan, thank you both for coming in, spending some time, giving us a fresh perspective on autism.
Thank you.